Hello everyone. I know that vaccination is on everyone's mind, and that's what I want to discuss today. But first I want to acknowledge that we lost our fourth employee to COVID, Blanca Kling. I knew her for many years, remember her especially for her work with the community after the explosion at the Piney Branch Apartments. She was deeply involved in and committed to the community. We feel her loss deeply and extend our sincere condolences to all of her family, friends, and coworkers. Blanca's death is a grim reminder that COVID is still very much with us. As we await vaccination, I continue to plead with you to maintain physical distance, wash hands frequently, and wear a mask. Now, vaccinations. I know there's a lot of frustration and questions, and I will try to address some of it. I would like to have a frank discussion about where we are in this moment. First, no vaccines sent to Montgomery County Health Department are going to waste. None are wasted, and none of our doses are sitting on a shelf. By the end of each week, we have given out all of the first doses that we received that week. So far, that is more than 26,000 people vaccinated. Second, the demand for vaccines is much greater than the supply. In Montgomery County alone, more than 200,000 people are currently eligible for a vaccine. There are a maximum of between 18,000 and 20,000 vaccines available each week for those 200,000 plus people. That maximum is the total for everyone giving out vaccines, the hospitals, pharmacies, and the county health department. That's it. Third, continuing announcements that more and more people are eligible have raised expectations. Yes, more people are eligible, but the vaccine supply has not increased. Telling more people they're eligible did not change the state or the county's supply, but what it has done is led people to believe that we are ready to vaccinate them. That is just not true. At the same time, the state has reiterated that Montgomery County's responsibility is to finish the 1A group. They are the people who protect our health and safety and whose jobs make them vulnerable to exposure. We can't afford for them to get sick. After them is the 1B group, the people who are 75 years and older. And to be clear, the state expects this 75 plus group to be our priority until we have completed that group. And at the rate the county health department has been allocated vaccines, that will be a while. At the same time, the state is providing vaccines to hospitals, pharmacies, and other entities, and they are allowed to vaccinate people in groups 1A, 1B, and now 1C. And these are the people between 65 and 74-year-olds. The doses going to group 1C conflict with the actual priorities for 75 plus, but the state's scheduling software at this time is unable to prioritize the order of who gets vaccinated and when. So while the governor said the county should be in 1A and 1B, that is not what the scheduling software is doing. But we are working together to try to rectify the scheduling glitch, which has created such an enormous amount of confusion and frustration. It will be many weeks before we can get through all of these groups at the rate of having a total of maybe 20,000 vaccines a week. And we want our process to be as fair as possible, which is why we have a pre-registration process. So please pre-register at our website. People who are 75 years and older have priority, but others can also pre-register so that we will be able to plan for future shipments of the vaccine. Once you have pre-registered, you will have to wait for an email link, which will come from c19vaccination@montgomerycountymd.gov. That link will allow you to register for an appointment. A few points. You may not get that link for many weeks. We're not sending it out until we have appointments that we can schedule. When you do get it, please do not forward it to others. We have had a lot of confusion and frustration with people receiving forwarded links that allowed them to register for an appointment when they weren't eligible. This is not helpful. You may be wondering in this day and age why this is still possible. Couldn't they design a system where the link could not be forwarded and have avoided this whole problem? Theoretically, yes, but they, the state, used an existing system that has worked well for flu and other vaccines, which are quite plentiful and easy to distribute. The system was not designed for this high-demand, low-supply vaccine, nor was it designed to accommodate prioritization of the people and the order in which people get the vaccines. I had a great conversation with the governor earlier this week, and we discussed this problem. As a result, his staff is working with our staff to address this, and they've already made some improvements and are working on more. And this is not a Montgomery County unique problem. Scheduling overload is burdening all the county executives that I spoke with yesterday. So this is statewide. I very much appreciate the governor's responsiveness, but I want to be clear that even with his cooperation, these problems can't be fixed by us, and they can't be fixed overnight. So people may be able to get appointments from a forwarded link, and then their appointments will be canceled if they're not supposed to have an appointment. That leads to confusion and frustration, so please do not forward a link, and please do not use a link that was forwarded to you. People are asking if there is another way to get in line for a vaccine. Yes, there are other ways, but they also have extremely limited supplies. Several of our hospital partners, as well as pharmacies in the area, will be administering vaccines to eligible groups. But you should expect that you may have to return to those sites frequently because our partners have very little vaccine and spaces fill quickly. Just to highlight that point, the giant pharmacies on the list will receive around 50 vaccines a day. So those slots, they won't be around very long. The website addresses for information about other sites is available at the link on the screen, coronavirus.maryland.gov/pages/vaccine. Scroll down on the page and you will see where you can put in your address and look for other sites. Some eligible individuals are being directly contacted by their provider who is likely connected to a healthcare system and that has been given vaccines for their hospital staff. While we cannot control that process, we are working with the healthcare systems so that we can reach as many of the eligible people as possible. Another piece of information. You may have heard that the healthcare systems get more of the doses than were delivered to the county. This was true last week. The healthcare systems get their doses of Pfizer vaccines, which must be stored at extremely cold temperatures between minus 112 and minus 76 degrees Fahrenheit. We do not have storage capacity for those vaccines, and we were told at the beginning not to purchase storage for those vaccines. The county health department receives Moderna vaccines, which are easier to store. This difference in storage temperatures impacts where the doses are sent and who distributes them. And a reminder that all these vaccines require a second dose. So even if supply increases, many of those doses will have to be used as second doses. So please be patient. The lack of supply is a problem in the state, in the country, and around the world. I am hopeful that it will improve in the coming weeks and months, and I hope you understand that we are doing our part to get the vaccine to you as fast as possible. In the meantime, we still need to maintain a physical distance. We still need to mask up. We absolutely have to stay safe. Thank you.